My topic today will be treatment of acute myeloid leukemia. A little bit about the history when we started, or not me, but my other colleagues in '78 with a disease which in almost all children died. In between, with a rather intensive chemo plus stem cell transplantation, we achieve an overall survival 70% plus, so it's a great achievement just by conventional therapy. The problem still is, as mentioned, it's rather intensive, and we are still looking for new options of treatment with equal or better, even better efficacy, but less toxicity. And this will be the main issue in this topic, to have or in this session to discuss the diagnostic biology and finally, mostly the treatment of acute myeloid, but also acute lymphoblastic leukemias. We have to learn much more about leukemogenesis, about the clonal evolution of the leukemic stem cell, to find new targeted, rather specific drugs targeting these specific molecular events, and by this it might be feasible to eradicate the leukemia. Unfortunately, I guess we will need chemo for another 2 or 3 decades, but this is the hope. The other issue are immunotherapies. Yeah, that's rather successful in the acute lymphoblastic leukemia with the CAR T cells, or also the BiTE approach. In AML, it's still a problem because we have not such a nice target like CD19. In ALL, we have just the CD33 or 123. Using treatment against these antigens, you just eradicate the myelopoiesis, and this is at the moment not feasible. But I guess we will find their options, and this will be another perspective finally to cure more or less all children. At the moment, I guess there is a breakthrough in the acute lymphoblastic leukemia. There are children in 3rd line or even 4th line treated with these CAR T cells and achieving complete remission, which was completely unexpected with other conventional treatment. So in ALL, I guess we have to learn more about this. We have to learn about escape mechanism. So to find the group of children where this treatment might be perfect, and finally further increase cure. In AML, it's much more difficult at the moment. I guess we have to look for these approaches with immunotherapies, with maybe other antigens, maybe combinations of antigens, maybe that one use this treatment option just in a specific scheduling prior to stem cell transplantation, something like this. But I guess there will be a future for this treatment option, and we all, in pediatrics but also in adults, are working really intensively in this field to make progress.